Ms. Park, welcome to the committee.
Good evening, Senators and everyone in this room. My name is Ju Park. I'm an assistant professor at Brown University in the School of Medicine, and I teach and conduct research on U.S. drug policy, and I support Senate Bill 1015. Every federal administration since Nixon has ramped up the war on drugs to appear tough on crime. But where has it gotten us? It has gotten us fentanyl, it has gotten us lots and lots of overdoses, and generations of Americans burdened with felonies. As a society, we've used the law to punish people who should be treated by the medical system. By intervening on prescription opioids and then heroin, we got fentanyl. And this is actually called the Iron Law of Prohibition, written by Professor Leo Beletsky, a law professor at Northeastern. And what this law predicts is that these types of actions, interdicting on the drug market, will cause and incentivize the market to produce more and more potent, concealable opioids. And so this is why we have this illicit fentanyl epidemic. And we cannot arrest our way out of this epidemic. My research in Rhode Island, Massachusetts, and Maryland has shown that in addition to causing the barriers that Lisa just mentioned, arrest for drug possession is the #1 barrier to accessing harm reduction services. So about this bill, 10 grams, it's a third of the charges actually are stimulants, not fentanyl. So things like cocaine and methamphetamine. Pill users are more affected by this. Also crack cocaine users who are more likely to be arrested and charged over powdered cocaine users just because of the substance itself. It's weightier, it's cheaper, it's more dilute. This bill could divert approximately 30% of the cocaine cases we see, and that can really help to reduce racial disparities as well. As we know, BIPOC communities in Rhode Island are more likely to be targeted for fentanyl and cocaine arrests, so this would really help. Drug addiction is a treatable medical condition, as you all know. We would never arrest smokers for having lung cancer to try to force them into treatment or punish them and, teach them a lesson. Let's stop wasting taxpayer dollars. As a taxpayer, I would say let's vote for science against racism and fear. Thank you for listening to my testimony.